Hello there, how are you doing? This is Dr. Samurai, a professor in Japan specializing in international social pathology. The topic of today's minute lecture is Dr. Michael Swango. Okay, the first half I would like to provide you the general information. So let's start today's third profile number 22. Dr. Michael Swango, he killed probably 60 patients between 1981 and 1997. 81 and 97, okay? So like 15 years. He killed his 60 patients as doctor using mainly poison, aka Dr. Death. Currently, he is at Colorado, Florence Supermax prison and serving 3 times death sentence up there. Okay, let's get into the details. This case of Dr. Swango is quintessential of what the psychopath is and how psychopath is produced. So this is going to be very instructive. His father was a Vietnam vet, and after he came back from the war, he became alcoholic, developed depression, severe depression. In the end, divorced from his wife. Okay? Michael did not have almost no substantial human relationship with his father, and he was more close to his mother. Living that way, his school grades were very high, and before the divorce, because of his father's being a military officer, they had multiple moves from town to town, which is very important when it happens to kids who is trying to develop their own personality. Because there is no roots anywhere of developing his stable friendship that has much to do with his personality. Anyway, okay. Finally, they ended up living in Quincy, Illinois. And there, as I have said, they divorced. Michael, for a short time period, entered Navy and spent time there. But later on, he entered Southern Illinois University, the School of Medicine, okay? And listen to this very carefully from here, okay? At the age of 3, Michael already developed pathological obsession with death. At the age 3, okay? Obsession with death. He liked pictures that have many dead bodies of Holocaust and concentration camps, or those accidents and crime scenes, which will put normal people away from watching. He instead was attracted to those pictures of many dead bodies, okay? And the interesting thing is, mother also supported his habit. So she might have had same kind of personality, or because of some stress, she were driven to that direction. We're going to talk about it later on, okay? He was one time working for an ambulance team. He rather took pictures of those people who were injured and with blood, injuries and scars and all that than actually helping as a rescue worker, which he was. His father also later on passed this scrapbook of his own, which had so many pictures of atrocious scenes of people being shot or executed at the war zones. After that, it is said that Swango said Dad was not that bad person after all, because they shared the same interest. Okay, and let's go a little deeper. At the Swango house, it was said that the air was completely different, whether his father was home or not. Swango was in the middle of three brothers, and when his father was not present at home, his mother was overbearing and very strict disciplinarian. But once his father was back from his duty and at home, listen, his house was as if one of the military facilities. His father was very strict, using corporal punishment and whatever. And those three Swango brothers and his mother included, everybody was feared. Everybody was afraid of Swango's father. And once he took alcohol in, he changed completely, and that changed Swango family's air completely. Okay? And it is also said during those times of hippie ages, 60s, everybody was kind of wearing bandanas and loose, colorful t-shirts and stuff like that. Swango kept wearing a shirt and buttoned all the way up, wearing a jacket. So during the 60s, those loose eras, he went through wearing only formal suits, which is a sign of a little bit of trying to control his own life, buttoning up all the way up and things like that. And his favorite movie was Silence of the Lamb, and he was into poison and Satanism. He was hooked with. Michael was especially into resin and arsenic as poison. So he might have been thinking about using it someday in the future. And even after he became a doctor, his most favorite moment was writing down "died" on the paper and put it on the body or next to the patient's bed. That's the highest moment of his as a doctor. Everybody kind of started to recognize the number of deaths of healthy patients was starting to grow after Dr. Swango's treatments. So because of that, 007, like a 007, he was nicknamed within the hospital that W.O. Swango because of the number of deaths after his treatments. W.O. Swango. I don't want to be called like that, okay? But anyway, an interesting thing is one colleague later said when a kid died of head injury, Swango confessed to the colleague that he erected. Okay, something is definitely wrong with this. His liking those couldn't stop at just liking it. He gradually started to put it into practice. He started to put poison into donuts, bacon sandwiches, and sodas for his colleagues. And in the end, his unjust act was publicly cleared. He spent one extra year and then flew over to Zimbabwe because it was uncomfortable staying on in America as a doctor, I think. There is a diary that he kept at Zimbabwe, and some of the records says when I look at the mirror, there was a person who is most dangerous with the extreme power standing right there. He himself was the God himself. He also wrote he liked the smell of sweet dried death within the same room. He liked the smell of death. Also, to one of his female correspondents, he wrote, "He is the smartest person in the world." And she asked, Have you ever felt guilt or remorse? Something like that. To that question, he goes, never. Not at all. That's why I could continue that for such a long time. That means because he did not feel any guilt, he could continue killing his patients for such long years. He has never thought about a thing so deep. He never regretted, or he never confused or panicked. He never felt things like that even once before. That's what he said. Remember what I told you about psychopath? Sociopath is made by social environment. Psychopath inherited those genes from their parents, right? So I think his case is more like psycho, and the shortest clear definition is emotional handicap, right? Never felt no guilt, no regret, no confusion whatsoever. And he was believing he was the smartest person in the world from the bottom of his heart. This is the kind of general information open in public, and I would like to tell you intense version of what I know about him personally. I'm kind of angry at him because I found out he responded to the question of the female correspondent. He never answered my direct question. He always ignored it, and all he did to me was just ask for a book he wants to read. Just asked me to check the information on the website and copy and paste it and put it in the same envelope. So he was kind of thinking he was above him because I was a college professor or whatever. But I am angry though because he didn't do the same thing to the female correspondent who was a little bit good looking, okay? Remember the fact that his mother supported his collection of those pictures of atrocious scenes. His mother also shared certain level of aggression, which was either due to what she already had naturally, or to the stress and frustration and fear from her husband. Either way. But based upon the fact that his father was alcoholic and his mood changed the whole mood of the family environment, it must have been very difficult for his mother to have peaceful, warm time with his baby Michael. Cause I guess when he was drinking, he was asking for crazy things and doing crazy things. So it must have been very difficult to have peaceful time when he was a little baby, you know? And that is the critical period that has most influence on the forming of human brain, okay? That is probably why at the age of 3, he already had strong interest in death. Like I said, critical period. The core critical period is from 0 to 2 years old, right? And we are talking about at the age of 3, he was into death, right? So during those 2 years, he could not have human communication or warmth of human skin or smiling warm responses from his mother. He could not have those things during his early infancy of 2 years of his birth, right? What kind of personality do you think that kind of infancy creates? I think it produces a personality close to cyborg or robot. It's like an inorganic existence because he never experienced organic experience, right? He was more like thing without communication with other people, right? So that cold and scary early infancy formed inorganic personality of his. So he felt more comfortable killing people, opening up the bodies and look inside of living beings, and pathological obsession with the death. Death is a thing. And he felt probably more comfortable with dead bodies than living bodies, because he did not have such time of enjoying time with other living beings or living people. And that typical inorganic, inhumane early infancy developed his inhuman features of personality. Does that make sense? No experiences as warm human beings, no warmth of other people's skin, okay? That led to the same unloving, no feeling existence that only looks like human beings. He was probably like highly aggressive robot. He, I guess, rather had doubts, could not understand why other people are interested in those love and things like that, which he never truly experienced as infant. Around the age 12, his father came back from Vietnam, right? But he developed severe depression and divorced from his mom. His mom, anyway, had higher aggression as a person. There's no doubt that she put higher pressure on Michael for high academic success, thinking that if Michael becomes doctor, her old life is guaranteed or whatever. She could live on Michael. That's my guess, but I think it's not far away from the fact. Also, even when her husband was out on the warfield, she might have been doing the same thing unconsciously on Michael and other kids. Higher pressure to be successful so that they could all get out of that hell caused by his father. I repeat though, his infancy was filled with very high level of aggression and tension by his alcoholic father, without any warm human relationship and no skin touch. After going through such abnormal infancy, all he received was pressure for success by his mother, and probably she didn't show a smiley face to Michael when his academic grades was not that great. So it must have been a conditioned love too. So that made Michael interested in destructive pictures and images. He lied all the time to avoid stupid mother's pressures and always hide his true feelings and personalities under such pressures. One of my major research is the relationship between family, environment, and personality developments. And I think this case of Michael and the critical period that he experienced and the emotionless personalities he developed later on, a quintessential case of pure psychopath. As I said, he blocked all my serious questions. So I sometimes thought if I had been working with him at the same hospital, I would have been killed for sure. Psychopath. It is created by 50% inheritance. Like I have said, his father and his mother were both into those atrocious, cruel scenes and pictures. So 50% by nature, kind of persuasive. But after his birth, almost zero warm physical contacts, always under fear, and later under academic pressure, without emotional exchanges with friends and peers. He developed emotional handicap, always pathologically lying, to avoid inconvenience and his mistakes. And he must have carried unconscious aggression too, because he lived pretty much all his childhood under pressure. He must have unconscious aggression all the time. And that's why he never felt any love towards other things than himself. But on surface, he performed and played as a doctor by copying what other doctors are doing. But when something happens that hits his interest locks on to that, whether it was his wants or his anger. That's the psychopath. Dr. Michael Swango is a typical example of pure psychopath, which is compared to This is pretty much it. This time, I think I put more information into minute lecture. But I think this minute lecture was important in that it was a very clear case of understanding what the psychopath really is and how that kind of personality is formed. So I would like you to maybe watch it a couple of times to have correct understandings of what the psychopath is, so that you could kind of feel who they really are. It is very difficult for ordinary people to distinguish who the psychopath is, but you keep facing those people and you start to smell the touch of those people when you pass them. Like when I pass real criminals, gangsters, mafias, and yakuzas and stuff, I could tell, even if normal people cannot tell. I'm not perfect, but what I'm telling is I can tell with a little higher possibility. So I hope you could share the same kind of sense to live wisely in this confusing world today. Okay, thank you very, very much for watching this time's a little bit longer minute lecture. I hope you found something interesting for yourself to improve your life. Okay, until next time, please have wonderful time with your loved ones or even on your own. Okay, bye bye now.